A silent predator is spreading its wings. Human Metapneumovirus or HMPV has emerged as the next global health challenge, catching the world off guard. But why is this virus making headlines now? What makes it different from COVID-19, and should we be worried? Recent spikes in HMPV infections have triggered alarm bells in the medical community and social media alike. Viral posts and videos from China showing overwhelmed hospitals and emotional pleas for medical help have ignited global concern. Hashtags like #HMPV Outbreak and #NextPandemic are trending, sparking debates. According to the South China Morning Post, these posts highlight overcrowded hospitals and a surge in respiratory illnesses, raising questions about a potential new health crisis. The World Health Organization, WHO, has issued warnings, urging nations to ramp up surveillance and testing. While COVID-19 caused a tsunami of devastation, HMPV is more like a rising tide, slow, subtle, but potentially catastrophic. The CDC has also flagged HMPV as a growing concern in their respiratory pathogen monitoring programs. Unlike the novel coronavirus, HMPV isn't entirely new. Discovered in 2001, it has lurked in the shadows, often mistaken for common respiratory infections. But recent mutations have amplified its ability to infect and spread, pushing it into the spotlight. According to The Lancet, a 35% rise in severe HMPV cases was reported last year alone. Welcome to Speculation Verse, where the future, theories and mysteries collide. At Speculation Verse, we dive deep into the unknown, the unexplained, and the unimaginable. This is your destination for mind-bending theories, speculative ideas, and fascinating facts that explore the boundaries of what's possible. Human Metapneumovirus is a respiratory virus that primarily affects the lungs and airways. It belongs to the Pneumoviridae family, closely related to the RSV virus, notorious for causing severe respiratory issues in children and the elderly. Symptoms include cough, fever, nasal congestion, and wheezing, mirroring flu or COVID-19. Transmission occurs through droplets, contaminated surfaces, and direct contact. Vulnerable groups: children under 5, the elderly, and individuals with compromised immune systems. While HMPV isn't a new discovery, the concerning rise in severe cases and hospitalizations has reignited global attention. HMPV was first identified by Dutch scientists in 2001 in children suffering from severe respiratory infections. Retrospective studies revealed that the virus had been circulating in humans for at least 50 years. Studies estimate that HMPV contributes to 5 to 15% of respiratory infections annually worldwide. Most cases occur in late winter and early spring, similar to RSV and flu viruses. In 2019, a surge in HMPV hospitalizations in the US led to its inclusion in respiratory pathogen monitoring programs. According to the CDC, HMPV was a leading cause of respiratory illness among hospitalized children that year. What sets HMPV apart is its ability to fly under the radar. Often misdiagnosed as the flu or a common cold, it has silently affected millions. But now, with enhanced genomic studies, we're beginning to understand its full potential for harm. How does HMPV stack up against the monster that was COVID-19? COVID-19 emerged as a novel virus, while HMPV has been around for decades. COVID-19 spreads more rapidly due to its high R0 value. HMPV's spread is slower but persistent. COVID-19 led to widespread death and long-term health impacts, whereas HMPV's mortality is primarily concentrated in high-risk groups. Vaccines for COVID-19 were developed within a year, but HMPV still lacks a specific vaccine or antiviral treatment, making it a sleeper threat. While COVID-19 demanded immediate attention, HMPV's gradual escalation gives it an insidious edge. Imagine a fire smoldering unnoticed. It's easier to ignore but equally destructive if left unchecked. Unlike COVID-19, where unprecedented global collaboration led to rapid vaccine development, HMPV remains without a targeted vaccine or antiviral. HMPV research funding has historically lagged behind due to its lower visibility compared to other pathogens. However, ongoing studies, including trials in the US and Europe, aim to fill this gap. Current treatments focus on symptom management, including hydration, oxygen therapy, and mechanical ventilation in severe cases. COVID-19 impact: over 760 million confirmed cases and nearly 7 million deaths worldwide as of 2025. HMPV impact: estimated to hospitalize over 1 million children globally each year. Though less lethal, its burden on healthcare systems during seasonal peaks is significant. These numbers underscore the need for preparedness. With COVID-19, we saw the devastating cost of being caught off guard. HMPV offers us a chance to act before history repeats itself. Social media is abuzz with alarming reports of HMPV outbreaks in schools and nursing homes. Epidemiologists have noted an uptick in hospitalizations, especially during seasonal peaks. A study published in The Lancet highlights a 35% rise in severe HMPV cases in the past year. The WHO has labeled HMPV a priority pathogen for global research and surveillance. Why the spike? Post-pandemic immune system shifts coupled with mutations in the virus are suspected contributors. In the United States, the CDC has noted HMPV as one of the leading causes of pediatric hospitalizations this season and is ramping up diagnostic tools. In India, the Indian Council of Medical Research has initiated a nationwide surveillance program to understand HMPV's impact, with vaccine research slated to begin by late 2025. Viral posts from China showing overcrowded hospitals have sparked international concern, with health authorities calling for urgent research and public health interventions. Understanding HMPV is the first step in protecting ourselves. Preventive measures include regular hand washing, mask wearing in crowded places, and avoiding contact with symptomatic individuals. Unlike COVID-19, HMPV testing isn't widely available yet, making awareness critical. Supportive care like hydration, oxygen therapy, and symptom management remains the mainstay of treatment. If there's one thing the COVID-19 pandemic taught us, it's that early detection and swift action save lives. Governments must fund HMPV research to develop diagnostics and vaccines. Just as with COVID-19, tackling HMPV requires international cooperation. Educating people about HMPV can prevent panic and ensure timely medical care. Will HMPV be the next global pandemic, or can we stop it in its tracks? The answer lies in how seriously we take this silent threat. Every cough, every wheeze could be a warning. Let's not wait for HMPV to become the next household name. Stay informed, stay prepared. Together we can face whatever challenges lie ahead. Thank you for joining us on this journey to uncover the truth about HMPV. Don't forget to like, share, and subscribe for more in-depth explorations of global health issues. Stay safe and stay curious.